Welcome back, everyone, to another explainer. Today, we're tackling what we call the professional's ascent. Basically, your journey up the medical billing and coding career ladder. If you've been following along with our series, you already understand that mastering the basics, well, that's really just base camp. Today, we're talking about the actual climb. How do you go from a standard entry-level position to high-level auditing, independent consulting, and eventually starting your very own medical billing business? We're pulling all of these insights directly from our core text to map this whole thing out for you. So let's dive right in.
Okay, here's our strategic roadmap for today. We're going to cover building your certification foundation, advancing through specialized skills, exploring auditing and consulting, launching your billing business, and finally, mastering practice management services.
Starting off with Section 1, building your certification foundation.
Like we said, every successful climb starts at a solid base camp. And in healthcare administration, that means establishing absolute trust from day one. So your first big choice is going to be between the two main certifying organizations. You've got the AAPC, established back in 1988, which is really the gold standard for physician practices and outpatient care. On the flip side, there's AHIMA. They've been around since 1928, and they are heavily focused on hospital coding and electronic medical records. But it's not just about passing their exams. Active participation in your local AAPC or AHIMA chapters, plus attending national healthcare finance conferences, that's absolutely crucial. That networking is exactly what fuels your career ascent.
A really important thing to keep in mind here is that a simple certificate of completion from a local training program is just not going to cut it anymore. True certification, meaning you've passed the rigorous official exams from organizations like AAPC or AHIMA, is the actual undeniable industry standard. In today's landscape of incredibly strict privacy and compliance rules, employers literally demand these credentials. Having them demonstrates your deep expertise, your commitment to quality healthcare, and frankly, it gives you incredible leverage when it comes time to negotiate your salary.
Let's move on to Section 2. Advancing through specialized skills.
As you gain some real-world experience, entirely new paths start to open up for you. You might find yourself aiming for high-impact roles, like a revenue cycle manager or maybe a dedicated compliance officer. Earning specialty credentials, like those from the Board of Medical Specialty Coding and Compliance, or becoming an advanced coding specialist, signals to everyone that you are completely committed to this field. Take the CCPP, for instance. That's specifically valuable for compliance professionals working in really complex medical practices. It helps you keep progressing as the sheer volume of required knowledge increases dramatically.
Now, another massive area of specialization is stepping into a role as a CDI specialist, which stands for Clinical Documentation Improvement. CDI essentially uses specialized software and strict processes to accurately convert a patient's clinical condition into precise coded data, and it's entirely fueled by the highly specific ICD-10 coding system. Think of CDI as a critical bridge. It makes sure clinical documentation is pristine, tracks doctor performance, aids in public illness monitoring, and guarantees accurate payments. In this role, you literally become the crucial link between a physician's raw notes and compliant revenue. It's a huge deal.
While you're specializing, you'll also want to master macro concepts, like the Accountable Care Organization, or ACO. This is a fascinating model because it links provider payments directly to patient quality indicators. Under the Affordable Care Act, ACOs are actually rewarded for providing concrete savings while caring for Medicare populations. If you understand this macro-level structure, you become invaluable. You're the one helping providers navigate these really complex financial incentives, which ultimately enhances patient care while reducing overall costs at the same time.
All right, Section 3, exploring auditing and consulting. Our source material has this great quote: "Once you become competent in coding, various options emerge." And that perfectly captures the next major turning point in your career. When you have truly deeply mastered the intricacies of CPT codes, modifiers, and all those complex payer guidelines, that competence unlocks entirely new doors. For professionals who want to work independently or maybe join a consulting firm, you get to step away from daily data entry and start looking at high-level advisory and oversight roles. Which naturally leads us to critical roles, like becoming a senior claims auditor. At this level, you aren't just filing claims anymore, you are actively investigating them. Fraud analysis in state-sponsored workers' compensation, for example, is a fascinating and highly impactful area. By applying your deep coding knowledge to detect systemic anomalies, you are tackling massive financial challenges. It really proves just how high the stakes and the professional rewards can get when you reach this altitude in your career.
Moving right along to Section 4,
launching your billing business. This is the summit.
Taking everything you've learned and launching a home-based or private independent business is the ultimate goal for many. But to operationalize this, you have to lock down the fundamentals first. Before you even touch a daily workflow, you absolutely must handle the legalities. That means formally registering your business entity, securing professional liability or errors and omissions insurance, usually called E&O insurance, and getting your critical clearinghouse contract set up. Only after that's done do you execute the 4 core phases of workflow: patient enrollment, insurance verification, robust account receivables management, and transparent reporting for your clients.
So how do you actually win those clients? Well, the best strategy is to pitch coding and billing as a combined service. That makes you an indispensable one-stop shop for a private practice provider's revenue cycle. When setting these services up, you need a clear pricing structure in your service contracts. You basically have to decide, are you going to charge a percentage of their collections, or will you use a flat fee per processed claim? Oh, and crucially, you must always ensure you have a fully executed business associate agreement, or BAA, with the provider before you handle a single piece of protected patient data. No exceptions.
I love this point from the text. One of the best things about owning a medical billing business is being able to organize your workload on your own schedule. Honestly, this is exactly why so many professionals make the climb. You get to decide what you'll be doing during your peak hours and what you can leave for later. Creating your own business doesn't just maximize your income potential, it grants you total control over your time and your lifestyle. It's a real game changer.
And finally, Section 5, Mastering Practice Management Services.
As an independent biller, you effectively become the financial diplomat for the doctor's office. You'll frequently have to explain payment choices, like credit cards or financing, and carefully navigate situations where a patient might have an inability to pay, say a 20% coinsurance. You have to maintain empathy while listening more and speaking less. But remember, handling this well is a massive selling point. When you market to private practices, you aggressively highlight how your expert management directly reduces their claim denial rates, accelerates their cash flow, and completely streamlines their outstanding accounts receivable.
The golden rule of patient interaction here is simple. Stick to the facts, protect the boundaries. Look, when someone gets an explanation of benefits or an unexpected charge in the mail, emotions run high. But claim processing is a business, and you must remain impartial. You want to moderate your concerns with courtesy, sure, but strictly stick to exactly what is on the paper or screen, and never overshare about your client's office operations. Maintaining strong professional boundaries protects both you and the medical practice you represent.
From choosing between the AAPC and AHIMA early on, to earning advanced compliance credentials, moving into high-level auditing, and finally launching your own independent billing business, you now have the complete blueprint. The career ladder in medical billing and coding is tall for sure, but the view from the top, where you find financial independence and true industry leadership, is incredibly rewarding. So the only question left is, what is your very first step going to be? Please like, share, and subscribe to Decode Healthcare with Harsha.